I picked Alzheimer's disease, and it is estimated that about 5.8 million Americans aged 65 and over are afflicted with this disease, and it is also the fifth leading cause of death in America. And we also see there is a drastic increase in Alzheimer's disease related deaths. The increase is nearly 147% over the past 20 years. And it is also estimated that the number of people living with this disease is projected to grow to about 13.8 million in the near future. This can be partly attributable to the baby boomers generation approaching old age. And as you can see, apparently Alzheimer's disease have gotten attention from many stakeholders worldwide. Many countries have Alzheimer's Disease Awareness Month, even though the month may differ from country to country. And here is an outline of my presentation. I will briefly talk about the disease pathophysiology, then I will go on to talk about the signs and symptoms of Alzheimer's disease. Then I will briefly talk about the epidemiology of the disease. Then I will go on to show you the spatial distribution of Alzheimer's disease related death and the different government plans in different states. Then I will talk about the cause of the disease, the risk factors, the public health impacts in terms of the cost to individuals and society. And finally, I will briefly discuss the treatment and preventive measures as well as the other public health measures to reduce the impacts of this disease. Alzheimer's disease is due to the growth of two kinds of proteins, the amyloid plaques and the tau tangles in our brain. These two proteins not only grow in our brain, they also have certain twisted strands in our brain. And because of that, it leads to a gradual and irreversible degeneration or even death of the neurons or the brain cells. The presence of these two proteins, or in their twisted forms, can also lead to the shrinkage of our brain areas. This ultimately leads to cognitive impairment or other bodily functions being affected. Here are the signs and symptoms of Alzheimer's disease. Confusion of time or place, irritability, mood changes, difficulty completing familiar tasks, social withdrawal, visual problems in some instances, poor judgment, trouble planning, misplacing things, wandering around, trouble in conversation, and memory loss. For older adults, the prevalence of Alzheimer's disease increased as one progressed from one aging phase to another. Because different racial ethnic groups have different combinations of the E2 form, the E3 form, and the E4 form of the APOE allele inherited from their parents, these may partly contribute to interethnic disparities in Alzheimer's disease. Maybe due to other factors as well. When compared to Caucasians or whites, blacks or African Americans have 2 times the odds of being diagnosed with Alzheimer's disease. When compared to Caucasians or whites, Hispanics or Latinos have 1.5 times of being diagnosed with this disease.
Women have higher risk for Alzheimer's disease, maybe because they tend to live longer than men. Women's higher risk for Alzheimer's disease may also be partly due to the interaction between the APOE allele with the sex hormones. When compared to those with two copies of the APOE E3 allele, those with one copy of the APOE E4 allele have 3 times the risk of being afflicted with Alzheimer's disease. When compared to those with two copies of the APOE E3 allele, those with two copies of the APOE E4 allele have 8 to 12 times the risk of being afflicted with Alzheimer's disease. The risk for Alzheimer's disease decreases with the level of education. This may be partly due to the functioning of cognitive reserve, which means the brain has the ability to make flexible and effective use of cognitive networks or neurons to enable a person to continue to carry out cognitive tasks despite brain changes.
The map on the left shows the age-adjusted death rates of Alzheimer's disease in the US from 2005 to 2014. I'm not sure if the regional breakdowns are based on counties or units smaller than a county, but the map on the left indicates that there are regional differences within the same state with respect to Alzheimer's disease-related deaths. As we can see from this map, the death rates for Alzheimer's disease are somewhat higher in the southeastern part of the country and the northwestern part of the country and in certain northern states. When we compare this map to the map on the right, we see that in certain parts of the country where the death rates are higher, there's no legislation filed or any plans to counter the negative effects or the health burdens of this disease. And as you can see from the map on the left, death rates tends to be higher in the poorer states in the southeastern part of the country. Here are the modifiable and non-modifiable risk factors for Alzheimer's disease. The non-modifiable risks can include the APOE E4 allele, the gradual and irreversible degeneration of neurons in the brain, or having a first-degree relative or more than one immediate relatives with dementia. A person's cholesterol level can also affect the person's risk for Alzheimer's disease. The same can be said for social isolation. As shown in the previous slides, the risk for Alzheimer's disease can also vary across racial ethnic groups. Some racial ethnic groups like African Americans or blacks and Hispanics or Latinos have higher odds of being diagnosed with Alzheimer's disease when compared to whites. This can be due to where they live and the stress they experience on a daily basis in connection to where they live. Some neighborhoods, some communities have high crime, high unemployment. people going in and out of welfare, people constantly having their utilities being taken off and turned on again. These can all be different stress factors associated with a given residential area, and all these may increase a person's stress level, which may also increase the person's inclination to use tobacco, to smoke. And in some poorer neighborhoods, there may be a lack of exercise facilities or a lack of transportation system that can bring people to gain access to healthy foods. Or in some neighborhoods, there may be a lack of healthy food stores. And all these can directly or indirectly increase the person's risk of being diagnosed with Alzheimer's disease. And researchers have also confirmed that certain physical comorbidities like cardiovascular diseases, hypertension or high blood pressure, diabetes and stroke can also increase a person's risk for Alzheimer's disease. Research has also found that the risk of Alzheimer's disease increase with the person's age. And this is also shown in the previous slide, where for older adults, the prevalence of this disease increased as one progressed from one aging phase to another. These are the causes of Alzheimer's disease to individual and society. And as you can see, the cause is estimated to increase over time within the next few decades. And it has also been found that if the inter-ethnic disparities in Alzheimer's disease is reduced or eliminated, this can lead to a reduction in about 230 billion in health expenditure. Reduction or elimination of inter-ethnic disparities in this disease can also lead to a reduction of 1 trillion in costs associated with premature deaths. Aside from medical expenditures, the cost can also take the form of loss in productivity, where people are sick and they have to be absent from work, or they cannot be as productive if they show up for work. The cause can also be the form of loss in wages or even premature deaths. And the cause can also take the form of caregiver stress. This is another important form of non-material cost related to Alzheimer's disease.
Previous research have found that physical comorbidities like diabetes, stroke, high blood pressure, and cardiovascular diseases can increase the risk for Alzheimer's disease. Because of that, taking these physical comorbidities into account can facilitate effective designs of preventive strategies aimed at slowing or avoiding cognitive decline and delaying the onset of Alzheimer's disease. And taking these physical comorbidities into account may also minimize the inter-ethnic, gender, and education disparities in Alzheimer's disease. Because of that, maybe screenings for memory loss and testing for different cognitive performances should be integrated into the primary care for diagnosis and treatments in diabetes, stroke, high blood pressure, and cardiovascular diseases.
And the other public health measures to reduce the health burden of this disease include proper stress management, attempts to improve sleep quality, or attempts to minimize sleep disturbances, efforts to increase healthy eating, efforts to encourage more physical activity, or efforts to prevent sedentary behaviors, and lastly, smoking cessation programs should be continued to reduce the health burdens of Alzheimer's disease. So, it is imperative for the local and even for the state government in some places, in some poorer neighborhoods, to improve their transportation system so that people can gain access to healthy food, or to build more sidewalks, to build more community exercise facilities, to build more parks so that people can exercise, or to prevent crime, to make their neighborhood safer so that people are more inclined to go out to exercise. And here are the list of references I use. Thank you.